If you've been told your core is weak, if you've done months of strengthening, if you've tried planks, dead bugs, Pilates, McGill Big 3, and your pain didn't change, this video matters. Because for some people with chronic back pain, the issue isn't effort, it's muscle quality. And that's a completely different conversation. Hi, I'm Antony, physiotherapist, nutritionist, and functional medicine practitioner. Here at NxHLife, we translate science into empowerment, so you can rise as a pain warrior and take back control. On MRI scans of chronic lower back pain patients, researchers often see something called fatty infiltration of the multifidus muscle. What does that mean? It means parts of the deep, stabilizing muscle have been replaced partially by fat tissue. If that statement triggers fear, breathe, because this is where most explanations go wrong. This does not mean your spine is collapsing, you're permanently damaged, or you can't recover. It means something far more interesting and far more hopeful. The multifidus is a deep spinal stabilizer. When pain first occurs, your brain often inhibits it reflexively. Pain, neural inhibition, reduce activation. If that inhibition persists for months, the muscle changes, disused, reduce neural drive, alter motor patterns, and over time, muscle cross-sectional area may shrink, fatty infiltration may increase. This is documented in chronic lower back pain population. But here's the nuance. Most rehab doesn't explain. This is not simply weakness. It's altered neuromuscular control. That changed how we approach rehab. Let's be honest. Many chronic pain patients have tried strengthening and failed. Because they're lazy. Not because they lack discipline, but because you cannot hypertrophy a muscle that is neurologically offline the same way you train a bicep. If the signal isn't clear, if motor recruitment is delayed, if protection reflex dominate, you're training around the muscle, not through it. This is where same symptoms, different drivers, different plan becomes critical. Studies show reduced multifidus cross-sectional area in chronic low back pain. Increased fatty infiltration correlated with duration. Alter activation timing on EMG, but here's the key. Correlation is not destiny. Some asymptomatic individuals also show degenerative muscle changes. Pain is not determined by imaging alone. That should sound familiar from your MRI video. Instead of, I need stronger abs, ask, is my deep stabilization system inhibited? Instead of, I need heavier deadlifts, ask, do I have motor control delayed? Instead of, I'm weak, ask, is my nervous system protecting? This shift from guilt to curiosity. That's the pain warrior identity. Important nuance. Imaging reversal is inconsistent, but functional absolutely improves. Motor control retraining, graded loading, contextual safety, even if fat remains visible, neural efficiency can return. That means pain reduction is possible without perfect MRI normalization. You don't need perfect tissue, you need adaptable tissues. The real danger isn't fatty infiltration, it's oversimplification. Some clinicians say it's all structural, others say it's just your nervous system. Both incomplete. Muscle quality changes are biological length, movement length, and protection length, all interacting, multi-dimensional. That's why one-size rehab fails. If you suspect muscle quality change, first, focus on slow, low-load precision first. Second, emphasize timing, not fatigue. Third, retrain position awareness. Fourth, avoid pain spiking overloading early. And last one, 5, layer complexity gradually. This isn't about smashing reps, it's about restoring communication. If you've blamed yourself for not getting stronger, just stop. Your system adapts to pain. That adaptation is reversible in function. You didn't fail rehab, you were given incomplete mapping, and that's fixable. Symptoms are signal, not random noises. Muscle change is a signal. Same symptoms, different driver. Some people need inflammatory modulations. Some need fear reduction. Some need neuromuscular retraining. You don't need more random exercises. You need a map. If this is the first time someone explained why strengthening didn't work for you, subscribe, because this channel is about decoding your pattern, not selling you the next generic fix. And if you want to take back control of your pain journey, you can download the free 7 Unspoken Truths About Chronic Pain. Let's turn pain into peace one step at a time.